Hey guys, I wanted to do a quick review from this weekend and also what we talked about online for lower quarter. We'll first talk about goal setting. And I think we'd all agree that collaborative goal setting is the way to go, in particular for our patients that have more chronic or complex pain disorders where they're not really going to get completely better, or you're not thinking that you're going to discharge them in 4 weeks and everything's going to be great. So focusing on functional goals, things that are realistic for them to accomplish, and sort of setting your program around that, and also your plan of care around that, can just help set the expectations and also make it a more collaborative process and realistic for our patients. So you have that patient, older patient with back pain, we're not thinking we're going to completely get rid of their pain, but can we get them walking better? Can they go up and down the stairs? Can they play with their grandkids? Whatever it is that is important to them, how do we guide them through that process and collaboratively set goals in order to, obtain what they want to do? So it'll probably take a little bit of extra time, and you could probably still, for documentation purposes, do more of the EMR goals or whatever it is. But I thought that blog post was timely because we've been sort of talking about this, and in particular also relating it back to setting the expectations for the plan of care from the get-go, and how that patient's physical therapy will progress over time. We also kind of discussed maybe doing, instead of just completely discharging someone, maybe doing a longer term follow-up, booster sessions, checking in on home programs, those kinds of things that'll keep that patient engaged and hopefully keep them on the conservative rehab path rather than going, routes to see doctors, get imaging, get other invasive procedures. We talked a lot about like a cognitive functional approach from the O'Sullivan group. Had you guys watch a video online. We also watched a few over the weekend looking at how would you help a patient to, or how would you help re-educate a patient's movement in a way that empowers them. So as physical therapists, we have an advantage. That's our thing. We help people move. We put our hands on people. And instead of just talking to them about their psychosocial issues or even doing pain education, we can get them moving and hopefully even change the way they feel about themselves by improving their ability to move during their fear tasks or functional tasks. So I thought we talked a lot about some good examples of that this weekend. Our two patients that came in were also examples of where we can make immediate changes in how they move and hopefully how they perceive their problems. So by giving them some hope, giving them almost like a window of opportunity where they're like, oh yeah, I can feel better, I can move better, that might actually change their perception of what's going on with them more powerfully than just talking to them or telling them about it. So I think that's it. That's a really fun approach. It's exciting to use because you can make such rapid changes without having to just do a lot of talking. It's more having them do an experiment with your guidance, and then they realize for themselves that they're able to move better and maybe even have some control over their pain. So hopefully, you guys are catching on to that approach and trying it out. A little bit of trial and error with it. You need to spend some time. As I said, it's a little more hands-on or difficult than just showing the patient a bunch of exercises, but the approach can be very simple. In practice, you're not having to do a variety of different things. It's maybe changing one little aspect of the movement, and that might be enough to sort of create this change that we're looking for. So I thought it was a great weekend. You guys are really engaged in the discussions and practicing. I really like your energy, enthusiasm, and kind of looking at yourselves as a leader in the profession and someone that is doing things the right way and wanting to make changes. So keep that up. That's definitely the goal of this whole program, is to sort of instill that in you guys so you feel like you're empowered to do that, and we'll set good examples for the rest of your colleagues. So fun weekend. In the next 2 weeks, we're going to shift down and talk about the hip. So I look forward to your discussions on that.